Quick disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
If you're newly diagnosed, maybe you've been wondering when to test your fasting blood sugar or what are the ideal numbers. Or perhaps you're frustrated by morning numbers that won't budge. Well, in today's episode, we'll be exploring your questions on fasting blood sugar levels and what really works to bring it down.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jeddah.
Hello, wonderful people. Dr. Jeddah here, and thanks for joining me for an episode answering questions about morning blood sugar levels, otherwise known as fasting blood sugar levels. Before we dig into this discussion, I want to let our members know that we now have a new health map available that focuses specifically on how to lower fasting blood sugar, with a step-by-step strategy to help you focus on the right things and, of course, how to lower fasting blood sugar naturally. So we walk through the primary nutrition strategies and proven natural supplements, along with other science-backed ways you can use to get those morning numbers lower. So for our members, just head to the members site and in the guides, you will find this new health map for lowering fasting blood sugar. Before we get into today's questions, let's do a recap on fasting blood sugar levels, the numbers. The goal ranges do vary slightly depending on the recommending agency, but generally you'll see the following ranges. The optimal normal range is between 70 to 99 milligrams per deciliter or 4 to 6 millimoles per litre. Your goal with pre or T2 diabetes is to try to get into this normal range or as close to this normal range as possible. For type 2 diabetes, fasting levels of 110 or 6.1 is still considered good, and then up to 130 or 7.2 is a more liberal target range, but it's realistic for many people, especially at first. But again, ideally, you want to be aiming for under 100 or under 6. So now that we've got those numbers straight, let's explore some questions regarding fasting blood sugar levels or fasting blood glucose levels, which are the same thing. So Brad asked, when is the best time to take a fasting measure of blood sugar? Now, I know for some of you this might seem like a very simple question, but for those newly diagnosed, you may often have questions and there is no stupid question except the one you don't ask. So Brad, it's best to test your blood sugar right when you get up, and that's what makes a fasting blood sugar test a highly convenient test for many people. If you make it a part of your morning routine, such as after you go to the bathroom in the morning, it's easier to remember. You can keep your supplies by your nightstand or in the bathroom or the kitchen, wherever you are most likely to remember, and that helps facilitate this routine. And obviously, making a note of that in a notebook or on-site log, such as we provide to our members, so you can have a record of those numbers and patterns. That's important. But yep, it's literally the first thing in the morning that you want to be taking a fasting measure of blood sugar. Betty said, my fasting blood sugar ranges from the mid-90s to anywhere from 104 to 116. It's so frustrating. I'm trying to be very careful what I eat and drink. So for our metric listeners, those numbers are between 5.0 and 6.4. So Betty, while you may feel frustrated, it's normal to see some fluctuations. A morning number or any other blood glucose number is never going to be exactly the same each day. A fasting blood sugar in the 90s to low 100s is actually not too bad. If you have some days at 90 or 5.0, your numbers are sometimes in the normal range, exactly where you want them. And on some days, your numbers are going marginally above normal, 116 or 6.4. So overall, you say you are very careful with what you eat and drink, and the numbers provide a pretty good sign you're on the right track. Now, if you're aiming to bring it lower, a few key factors can help. Meal timing, especially your evening meal, not eating too late, protein and fat balance, managing stress and sleep, and using natural supplements, berberine being one good example which we covered extensively in episode 21. Since you're within the normal range or just outside it, making a few tweaks to your routine will likely be enough to get those numbers down a little lower. And you can find more tips on doing this in episode 38. Michael asked, should I increase fibre intake, possibly at night, and would it help lower my numbers in the morning? Great question, Michael. A fibre-rich evening meal can help with morning blood sugar, but its impact will vary from person to person. Research shows that soluble fibre, for example, taking a fibre supplement like psyllium, can slow glucose absorption and improve insulin sensitivity, and it happens to be very beneficial for lowering fasting blood sugar levels. In fact, studies have shown that after 8 weeks of supplementing with psyllium, fasting blood sugar can be reduced by an average of 43 to 52.6 milligrams per deciliter or 2.4 to 2.9 millimoles per litre. And by anyone's measure, that is a substantial reduction. So in addition to eating a fibre-rich meal, try adding 5 grams of psyllium husks in about 8 ounces or 250 mils of water 20 to 30 minutes before your evening meal. We'll also leave some more info on psyllium in the show notes, and for members, you can find all the details on the most effective supplements for fasting blood sugar, all listed in the new health map on lowering morning blood sugar, which can be found in your guides. On to the next question from Hannah, who said, I swim 2 kilometres, which is 1.2 miles every morning, 6 days a week. I have taken blood sugar readings on waking and it's around 6.2, which is 111. When I return from swimming, the reading is 6.8 or 122. Why? She asks. Most waking hours, my blood sugar is between 4.0 to 6.0, and that's 72 to 108. I only have higher readings in the morning. Any official fasting blood tests have been performed in the morning after swimming. Should I take my next fasting blood test a couple of hours later? I would appreciate any suggestions on reducing my waking blood sugar. Well, firstly, Hannah, it's great that you're so active. And what you're seeing in this situation is likely due to the body's natural glucose response to exercise. When you swim, your body releases stored glucose from the liver to fuel your muscles, which can cause a temporary rise in blood sugar, and that is completely normal. And alongside exercise, it can be common for people to see a temporary rise in blood glucose levels. Since official fasting blood tests are typically done after 8 to 12 hours of fasting, it's best to take them before exercise rather than after, as those post-exercise readings may not reflect those true fasting levels. So you say your reading upon waking is 6.2 or 111. Well, that's your fasting number. That's your true fasting number because that's upon waking, and it's within an acceptable range and not far from the normal range. So making some minor adjustments may help fine-tune your morning readings. And we had some suggestions on doing that in episode 38. And your numbers are in a good range most of the day, so that's fantastic to hear. So keep up the great work. And if you do have an official fasting test via the pathology lab, definitely consider doing this before exercise for a better reflection on that fasting number as well.
Are you ready to take charge of your diabetes health? Dr. Jetta's T2 diet program has been clinically proven in a randomized controlled trial to dramatically reduce A1C, weight, and medications in just 16 weeks. The T2 diet program will guide you step by step to discover an eating plan that feels natural and sustainable for you, and most importantly, works to get results. Learn more and join the program today at type2diabetestalk.com/programs.
Susan said, I am concerned about my fasting blood sugar levels. Upon rising, I measure my blood sugar. Some days it is normal and other days it isn't. For example, my blood sugar was 113. An hour later, it had risen to 155, even though I had not eaten or drank anything. This has been occurring periodically for the past 2 months. Please help me understand what is happening to my body. Susan, as we've mentioned a few times already, what you're describing is likely due to the dawn phenomenon. So in the early morning, your body releases hormones like cortisol and glucagon to prepare for the day, prompting your liver to release stored glucose, which can raise blood sugar. These are basically our wake-me-up hormones, and we all get this response in our body in the early hours of the morning. So we discussed this in detail, why and how this happens, in episode 38. So I'd encourage you to listen to that episode. It could also be due to the feet on the floor effect. So simply getting up and moving around can trigger a type of stress response, as we saw in relation to Hannah, who was doing exercise, but even just getting up and doing things like a bit of housework or something like that. It can lead to increased levels of cortisol and adrenaline that can also spike glucose release from the liver, even without eating. For many people affected by this, it helps to eat something, a small handful of nuts, for example, and some people even keep their nuts beside the bed. And it often helps to eat breakfast before trying to do too many things, preferably eating a low-carb breakfast with lots of protein and healthy fats. You can also try implementing some strategies we spoke about in episode 38 to help improve morning levels. And if you're one of our members experiencing similar issues, view the new health map on lowering blood sugar for additional steps you can take. Francina said, my morning blood glucose levels are above 8 to 10.5 most days. What can be the solution to this? Francina, consistently high morning blood sugar, 8 to 10.5 millimoles per litre or 144 to 189 milligrams per decilitre, suggests that overnight glucose production is a key factor. The main causes could be the dawn phenomenon, that early morning hormone-driven glucose release, or prolonged elevated blood sugar from the previous day's meals. In episode 38, we talked about why morning blood sugar is often high, so we're not going to go into detail here, but it is often related to hormonal changes early in the morning, that dawn phenomenon. You can still have some influence over this by making adjustments to your nutrition and lifestyle. And the first thing to consider, though, is whether your A1C is high or your post-meal glucose readings are high. So if your A1C is high, it's unlikely that your morning blood sugar will lower. So your first step is to address the A1C level, aiming for 7% at first, and then trying to aim under 6%. And you can do this primarily by adjusting your nutrition plan. Once your A1C numbers are in the target range, it can still take a while for morning numbers to balance, up to 2 years in some cases. But if your A1C and post-meal numbers look good, then give it some time and apply some other strategies that we talked about in episode 38. Assessing your nutrition, cheese and apple cider before bed, some natural supplements, meal timing, assessing sleep and stress. There are lots of factors you can look toward, and there are lots of science-backed strategies that help to lower those morning numbers. Before we hear another question, let's hear a testimonial from one of our members.
Gina said, I have been trying to eat well since I got your recipes, and I lost 11 pounds. Plus, my diabetes has improved a lot. Thanks for all your recipes and support. I really appreciate it.
Okay, the last question for the day comes from Rebecca, who left us a voice message. Let's listen to that now.
Hello, this is Rebecca Wilson. They sent me the email regarding the fasting in the morning. I'm type 2 diabetic, a year and a half now, and I worked really hard for a year and a half to get my A1C from 13 to 7, and now it's up to 9, but it's probably getting higher. The last month or so, my sugars are staying around 290, 280 to 300, and I'm not sure why. My eating habits are back to just salads and vegetables and fruits and protein, and not exercising as much, but I'm going to start that. But my sugars are about 300 in the morning, 280, and I'm fasting till about 1 because if I eat in an hour, it's going to get higher. And so I've been trying to fast until about 1 so that when I do eat, it gives it time to come down. And then when I eat, it's not going to be extremely high. But I'm also losing weight. I've lost another 5 pounds.
This is an interesting scenario, and since we don't have the whole story, we have to try to fill in the gaps here. So Rebecca has an A1C that seems to be increasing quite rapidly, despite her eating habits being relatively healthy. Sugars that are staying high, even though it sounds like those meals are low in carbohydrates. Fear of eating in the morning so as not to increase blood glucose spikes even higher. And weight loss, which sounds unintentional the way Rebecca describes it. Even though you're not doing as much exercise, it sounds like you're doing some. And even though it sounds like you've pulled your diet right back into alignment, it sounds like these elevations have occurred despite a relatively healthy routine. The persistently high blood sugar, even while fasting, suggests inadequate insulin action. So we'd be thinking insulin resistance, which is common in type 2 diabetes, but in this case it sounds a bit more like insulin deficiency worsening. This could indicate progression of beta cell dysfunction, which can occur in type 2 diabetes over time, but it's unusual in those newly diagnosed. And you've only been diagnosed 1.5 years ago, which isn't that long. And while the weight loss could be due to the fasting and dietary intake, losing weight while having high blood sugar raises concerns about that unintentional weight loss, which again could potentially point toward significant insulin deficiency, or in other words, your body may not be producing enough insulin. The first thing to question is whether you have latent autoimmune diabetes in adults, called LADA or LADA for short, which is often misdiagnosed as type 2 diabetes. LADA is an autoimmune form of diabetes, like type 1, but with a slower onset. And it's also known as type 1.5 diabetes, as it's got characteristics of type 1 and type 2 diabetes, and it's often misdiagnosed as type 2 diabetes. So the pattern you're suggesting sounds like a common scenario seen in LADA. Being that you were diagnosed not long ago, we don't know if you're taking medications, but you had a good initial response to your diet and lifestyle strategy with your A1C going from 13 to 7, but now you're seeing sharp rises across all your blood sugar metrics and you're experiencing weight loss. And these can all be classic signs of LADA. So one of the first things to do to rule this out is to get some tests from your doctor to test antibodies and C-peptide. Since in LADA there is some beta cell dysfunction in the pancreas and there can be a gradual deficiency in circulating insulin. So your treatment is going to be different from type 2 diabetes, and most people will need small doses of insulin. And this is really important because you don't want to delay proper treatment and risk developing complications. Of course, it may be attributable to other factors. Maybe the prolonged fasting is backfiring, contributing to higher fasting glucose, so perhaps you could try a small protein or fat-based snack or meal first thing in the morning to evaluate what happens. A small early meal may help suppress that excess liver glucose production and stabilise blood sugars later in the day. We don't know what your eating habits or nutrition plan have been like, so you could look at exploring adjustments here. You could look toward reintroducing movement, as we know exercise can help lower glucose. So adjusting carbohydrate intake, eating earlier in the day and reintroducing movement, that might help stabilise blood glucose levels. It would also be important to evaluate whether there has been anything else in the past couple of months that may have contributed to this rise in blood sugar. Illness, infection, or stress, for example. Troubleshooting all of these things may be useful, but the first step would be having some tests to ensure your diagnosis is accurate so you can assess the next best steps to take given the circumstances. If you do have later diabetes, that latent autoimmune diabetes in adults, then your course of treatment will be different. If you don't, then various other factors need to be assessed more closely, as you are seeing quite a rapid rise in blood glucose and those A1C numbers in a very short amount of time. So if you do need help assessing those factors more closely, the best course of action for you would be to take personal one-on-one nutrition coaching with someone like myself, as you need that dedicated attention to help you troubleshoot those more complex issues like this. And you can find out more about getting personal help on our website. So for everyone who submitted their questions for today's episode, I thank you very much, and I hope you found those answers useful in helping you achieve better numbers. So that's all for today's episode. We have covered why fasting blood sugar levels fluctuate, what's considered normal, some of the best ways to lower those numbers naturally, which you can also learn more about in episode 38. And we've covered some troubleshooting tactics for more complex situations where things don't seem right with blood sugar numbers, despite your best efforts. So again, I hope you've found some useful tips and insights you can apply to your own situation to get better results. Remember, if you're one of our members, we have our new health map for lowering morning blood sugar levels now available for you, providing a clear, step-by-step process to lower those fasting levels, naturally of course, with detailed information and checklists to guide the process. Thanks for tuning in, and I'll see you next time. Dr. Jeddah, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. US Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.